Hi everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean. Mr. Dean, thank you for coming out today. It's been quite a while since we have filmed one of these video updates, but we have received some requests to let people know what's going on, what we're seeing here locally within our health system.
Well, thank you, Erika, and good morning to you and to the viewing public. You know, it has been a while. We're getting asked a lot more now about COVID-19 because it's even more prevalent in our community. The symptoms are showing up, more are being diagnosed positive than in the past few months. And we just want to get everybody up to speed on the facts. The fact one is COVID has been with us and will remain with us, and the only way to battle COVID is to become vaccinated. Otherwise, take a risk of being infected. The Delta variant has really caused a new dynamic in the battle against COVID. It is a more infectious variant of the first virus we encountered. It is important that everybody understands that, and it has having an impact on hospitalizations. If you remember, Erika, back in January, we had as many as 90 patients in the hospital, and it was the second wave, and that was a lot of patients. And we got down to about 3 patients in the hospital, you know, some weeks after that peak. And then we went for a while, and we relaxed everything. And then the Delta variant made its way across the United States. Many of the viewing public heard that it became prevalent in Missouri, Arkansas. Well, now it's everywhere, and it's in Valdosta, Lowndes, and South Georgia. What's important about that is that it seemingly is causing those that have not been vaccinated to be hospitalized more. 96% of those that are hospitalized today have not had a vaccine. I know that's a politically charged subject, but we just have to stay with facts, everybody. Vaccination blunts the tip of the sword when it comes to the battle against COVID. You can't argue that, and it's just real. Average age of patient that was in the hospital back in January was 65. The average age of patient today, the 34 patients we have today, is 55. So it's a younger cohort of patients. And yes, some are being mechanically ventilated because they can't breathe on their own. So I would tell you, we're now experiencing our next wave of COVID-19 impact on our community, and I would just appeal to everybody to rethink your position on vaccinations if you have not decided to be vaccinated. It's important to take advantage of that, I think, to kind of, you know, deal with this thing as it sort of moves through our community in the current state.
Yes, and a little different this go round is that our volumes are extremely high, and specifically in the emergency department. We're seeing a lot of people come through.
We are. You know, again, you come to the emergency department when you feel bad and when you can't breathe because you have these COVID symptoms, you come. And that's why we're here, and we're delighted to take care of folks. Just to give you an example, we average somewhere close to 200 patients, plus their family members or guests every day. Over the last few days, we've been over 250. I think 277 patients day before yesterday, 260 patients or so yesterday. A high percentage of those are coming with COVID symptoms. Just remind everyone, we have specialized treatment for those that can have an infusion and go home. We have our infusion center set up, and those infusions do help. And then there are others that, you know, have to remain in the hospital. Many that are coming to the emergency room are asking for testing. As a matter of fact, many that are already symptomatic are not only asking for testing, but they're saying, can I get the vaccine also? Well, it's too late. I would suggest to everyone, if you are undecided on vaccination, go get vaccinated. If you come here, we're going to test you, and we're going to treat you, and you're going to get great care. But what we'd really like is to have less having to come here because of the symptoms. And again, just to repeat myself, we have to get more vaccinated to sort of curtail that.
Yes, and we do have our vaccination center open at our Smith Northview campus, so people can make an appointment if they like, or they can just walk in during the weekdays and get their vaccine.
Yeah, we had the drive-through out there for a long time, and then we had not so much utilization of it, so we moved it just inside the door. It's open from 9 to 2:30, I believe it is, every day, Monday through Friday. Walk-ins welcome. So you can go out there not only to receive vaccination, but testing can be done there and through the urgent care center at Smith Northview or your private doctor's office.
Very good. Mr. Dean, how is our team at SGMC holding up?
Yeah, they're holding up now. They're tired, but they're built for it. And I don't walk in their shoes. I'm around them. But I just left a patient floor, one of our COVID units, and it's tough. Now, again, we take care of a lot of patients. We're taking care of a lot of other type patients, and we're taking care of the COVID patients, and that's why we're here, and we're proud of that. But we are sensitive to their needs, and I would say, this whole COVID pandemic, as everyone knows, has been a drain on the healthcare workforce. As strong as they are, they still sort of, tire out. So we're doing everything we can to support them. We're going to do more, and I know the community will, as you have in the past. One of the things we pay attention to are the number of visitors in the hospital. It's not only about, lessening the chance of passing this contagion along, but it's about also, protecting the workforce and the patients that are in the hospital. So we're not changing our visitation significantly, although the viewing public might see us ask you to wait in certain areas depending on how many COVID patients. For example, the ER lobby. That lobby might fill in times like this, and it's safer for the guest of the patient to wait outside, maybe in a car, or maybe in some other areas we've made available. So just look forward to that. We believe patients should receive visitors. Non-COVID patients should receive visitors, and even our COVID patients. It's hard being in a bed for a number of days and not being able to see somebody, and we're going to constantly be thinking and be reminded of what that means, but we also have to control the situation, and that's where these visitation policies come in. So I think, Erika, team's good, we're ready, built for it, strong, and we're going to get through this together. And my appeal to everyone is, please become vaccinated if you haven't already. It'll help you, help your family, and help others. It's real. Look at the facts, and I think let the facts drive your decision, and that's what we would ask you to do at South Georgia Medical Center.
Thank you, Mr. Dean. And we have resumed our daily updates on our website, so the viewing public can go to our website anytime and check out information for testing, vaccinations, current trends in the hospital. And so I would just encourage everyone to go ahead and do that and use our website as a resource for you to make decisions for what's happening here locally. So thank everyone for tuning in, and thank you, Mr. Dean, for joining us today.
Thank you, Erika.